On this week's show, we take a closer look at Africa's healthcare challenges, as well as some of the medical innovations that are making a difference across the continent. Joining me in studio this week to share their insights is Dr. Joe Molete, a molecular biologist and executive director for biosciences at the CSIR, Stavros Nicolaou, senior executive for strategic trade at Aspen, and Christian Dizio, sales and marketing manager at Lodoc Systems. Gentlemen, welcome. Now, Joe, I mentioned the statistics, and although things are improving in Africa, we're still sitting with considerable healthcare challenges. You know, you've practiced medicine all over the world. You're now involved in biosciences in South Africa. What is still the biggest risk and the biggest aspect, the most challenging aspect of dealing with healthcare on the continent?
My role is really to develop new innovations, technologies that can address some of the healthcare challenges. So where I am currently, I work with a group of most talented creators, innovators, almost about 180 of them in biosciences, and about 60% of our staff have master's and PhD degrees. So what they do really is to look at the challenges and say, how can we innovate? So we're working on things such as diagnostic products so that we can diagnose these diseases. We're also working on some therapeutics to see if we can come with biologics, because the world as it is going towards more biologics than chemical therapies. So those are some of the innovations we're looking at.
From an African perspective, though, what are the diseases or the illnesses that are still taking precedence when you do development and research at your department?
Of course, we focus on HIV, AIDS, TB, and now looking at some of the communicable diseases such as high blood pressure is starting to be a problem and has been a problem anyway. Diabetes is another one. So it's a complex problem, because the problem is not only the disease but the input factors such as poverty. People need access to food. So we're also looking at how we can come with indigenous natural food products and a whole lot of other things that we're working on.
Now, Stavros, Aspen works across 150 countries, both in the branded and the generic space. Are you seeing similar trends on the ground? Is HIV and AIDS and perhaps the antiretrovirals a massive focus for Aspen on the continent?
Well, I think what's becoming clear in the continent is we're starting to see the emergence of what are called non-communicable diseases. In addition
diabetes,
to
cardiovascular disease.
Correct, all of those. Asthma is also becoming prevalent. So I guess Africa's a bit of a dichotomy. You get the worst of infectious diseases, and then you're starting to see an emerging trend around these non-communicable diseases.
These lifestyle diseases.
Correct. And somewhere in between the two overlap, because there is some overlap. But I think what is encouraging is the continent's made great strides in addressing the infectious disease component. So I think we've made tremendous progress the last decade around controlling HIV on the continent. There's around 6 million patients on treatment with ARVs on the continent. I mean, that was unfathomable 10 years ago. It was really unimaginable. So I think we've made great progress there. And now the attention is slowly turning to consolidating your HIV, TB, malaria to a degree, consolidating that position, and then moving across to addressing non-communicable diseases. So that's why even the minister in this country, Minister Molete, he talks about a quadruple burden of disease. Yeah. And HIV, AIDS is one aspect of that.
Now, innovation is driving assessing and diagnosing and dealing with these diseases, but innovation, they see, is born out of a need. And let's take a look at the Lodoc system. I have to tell the story. I was on a flight to Dubai the other day and catching up on my episodes of Grey's Anatomy. Sometimes, you know, you can't watch TV as a journalist. And there was an excitement about this new piece of machinery in the program, and it was called the Lodoc system, and which is actually a proudly South African innovation. Okay. Now, from a Lodoc's perspective, your innovation did not initially focus on healthcare. It was actually a scanner at one of the leading South African mines to look for resource concealment. How did it change from that to the medical innovation it is today?
So as you say, the need for the machine, or rather the predecessor to the machine, was born on the De Beers diamond mines. And what they were noticing in the late 80s, early 90s, is that a lot of their diamonds were being stolen off the mines. So they commissioned a team to put something together that could scan the miners. But at the same time, it had to scan them very quickly, because you've got a whole bunch of miners coming off the mines at the same time. Very low dose, obviously, because you can't expose someone to high
X-rays every day.
Exactly. And at the same time, though, you need to have a very good quality, because you'll be looking for tiny, tiny diamonds. So they developed what was called at that stage the ScanX, which was an upright monitor. You would walk into it, do an up and down scan, and the guys would be kept, check if there's any diamonds, and then they could carry on. While they were doing the development though, someone of the original team came up with the idea, but hold on a second, if we do that, does it not now get a medical use? And that's exactly how Lodox and the original StatScan product was born. Same premise, although now you can scan a person who's lying down, which in a trauma or a forensic situation is very beneficial.
Now that's the value of research and development. At the CSIR, how much effort and time, and obviously it's a core research foundation, but from a medical perspective and a healthcare perspective, how much time is being spent on this side of the economy and of dealing with issues on the continent?
I think I must put in perspective, the biosciences is one of the units in CSIR. We are a very multi-diverse team working in defense, roads, bridges, environment, and all spheres. So I think about 10% of the team is in biosciences. So it's about 200 people out of 2,500.
10% is not a bad,
so
a bad ratio.
It's a bad idea. So that itself poses what amount of work we can do. So we can only do a limited amount of work as we are doing currently. As I said, diagnostics being the focus, some of the therapeutics being focused, and we do have other units working on ICT. I mean, you've heard in healthcare there's a need to go into electronic records, centralize things. So we have a group of scientists who help working with the Department of Health to say how can we come up with the systems that are robust, that can be standardized across the country itself, so that wherever you go you can get the same records and everything. So those are some of the innovations that we're working on.
Now, from an innovation perspective, Stavros, illnesses are evolving, and you mentioned the triple burden that Africa deals with. From a pharmaceutical perspective, how on top of research and development is Aspen, and specifically geared towards the African and the developing markets?
So I think Aspen focuses more on formulating and developing manufacturing, so new manufacturing technologies. And obviously we look at where there's a need. So let's just default back to HIV for a moment. One of the single biggest challenges to rolling out an effective ARV public program was the plethora of drugs that patients had to take. And at the start, sort of a decade ago, they were taking as many as 8 to 12 tablets a day.